guys, I really apologize for the bad video quality, but at least I'm trying to make something like a vlog update for you guys, since today I am exactly 10 months post-transplant. So I had my stem cell transplant in Moscow, Russia, exactly 10 months ago. But anyways, like every month I've made a vlog about how I'm doing, so this month will be the last vlog for the year. For the time being, currently I'm doing okay. I'm doing pretty well. Nothing significant as an improvement related to like the possible bonuses that any person could possibly gain from a treatment like HSCT haven't really like emerged. I haven't noticed much change in comparison to last month. I told you about my symptoms, and I feel that maybe something that could be considered as an improvement is my bladder function. Personally, I feel, well, not that anyone else could tell except a doctor based on objective clinical examination about my bladder function. But personally, I feel that my bladder function has improved, at least somewhat, and that is something, one of the most embarrassing MS symptoms, and I'm really happy that has improved. And it just that recently I noticed. I didn't notice it before. Like, many people notice the first improvements, if there are any improvements, because it's not given that all patients will definitely improve during the post-HSCT recovery period. But as I told you a couple of months ago, even though I didn't at that time, I didn't have any significant like experienced symptomatic improvements, I still wanted to stay cautiously optimistic and hopeful for the future possible symptomatic improvements. And so far I've been quite stable, which has been the most important thing and the most positive thing, because it's a clear indication of the success of the treatment. But of course, since I'm only 10 months post-transplant, I haven't yet reached the 1 year mark, when it's probably somewhat safe to say that the treatment has been successful, although it's only the MRI that is able to determine whether it has truly been successful. Because new possible lesions, MRI activity can always be something that might happen to some people, unfortunately. But until that, MRI will have next year at some point. I'm not sure when and where. Maybe in Russia, maybe in my home country. I don't know yet, but I don't want to think that far yet. Currently, the most important thing for me is that I'm pretty stable right now, and some slight symptomatic improvements are possibly coming along, and every single one is a huge bonus for me, because the most important thing, of course, for the treatment to be successful is that the disease progression is halted, which is possibly happening to me. I really hope so. 10 months is a long time, but it's not enough to tell whether the treatment has absolutely and certainly or for sure whether it has been successful and whether my disease progression is halted. But so far so good, like I've said before. What else? I also have been doing pretty good when it comes to my cognitive functions. Like I've told you before, last couple of months ago I had a test, and that was pretty, although I probably won't pass the test, but I feel that um, the fact that I actually went and I had all the preliminary exercises and studying for the test, that I was really able to go through with all the hard work that really took a real cognitive toll on my brain. That just amazed me because I really was able to do that, because 5 years ago I actually was compelled. I had to stop studying because I wasn't able to write with a pen. I wasn't able to concentrate from my pain, physical pain. But along with the years having MS, there was also the cognitive burden and factor, all the damage that was done to my brain by the MS inflammation also had a great negative impact on my cognitive functions. But with HSCT, I feel that some of the lost abilities, considering I have 3 black holes in my brain, I feel that some of the lost has been regained, at least partially, which is really awesome. And that for that I'm truly deeply grateful for the great doctor who treated me and who is even now willing to go through with my lab test that I keep sending every month for him to see whether they're fine. And actually currently my blood tests are all normal, which is very good. I think it's a wonderful thing to be able to like be less cautious. Of course I will stay cautious probably for the rest of my life, but I try to minimize that now, since being extra cautious also most of the time can also raise my stress levels, which is very bad for MS because stress makes symptoms worse and can even cause a relapse, provoke a relapse, possibly new symptoms. All in all, I'm just very grateful that I have made it through all the hard first months after the transplant, and it truly has been a roller coaster. But I still feel that the roller coaster could have been a lot worse. I didn't imagine it to be like this. Like, of course, you never know what to expect if you haven't had the treatment before. But for the people who haven't been through HSCT, and especially the post-transplant recovery phase in itself, I can reassure you that it surely can be a lot different and sure will be very different in different people. But also there are a lot worse things, and I think that having to live with MS and acknowledging that you haven't had treatment like HSCT to possibly halt the disease progression, that is something that just even the thought of it makes me uneasy. So even if I had more dramatic and more heavier and more difficult recovery phase, I would probably still think that it has been worthwhile, and as long as it doesn't kill you, it just makes you stronger and you can be truly hopeful because at least you have had the treatment. And what comes afterward, if you have had the treatment and it has been successful, all what will come after during the recovery phase, I think anyone can make it through with the great inner strength one has after such a massive and life-changing treatment as HSCT. So that is, I think, enough for the symptoms. In 1 week I am going to see a neurologist. I can't say my neurologist because this current system in my country where I'm treated currently is not the way I wanted it to be. I really would like it to be, But each time I see a neurologist, usually the neurologists are different people. They change shifts, and I can't really have one person to treat me and to get to know me, and that's something that I just dislike, because it really doesn't make the patient feel that the patient has much value, but enough. Maybe I should not criticize, because the main point is that I am treated, or at least they think they're treating me, because I think the most treatment I have ever got throughout my during the 5 years I've had this disease was when I had the transplant, when I spent a whole month in Russia, and I received the best, absolutely best care physically and mentally. I've never felt so happy and so good in a hospital environment. And in addition to that, of course, I got the best chance to halt my disease progression by undergoing HSCT for MS. But yes, like I've told you before, the neurologist in my country and in most countries except Russia and some other countries where HSCT is not approved as a standard MS treatment, neurologists are kind of ignorant and skeptical when it comes to HSCT used to treat MS and other autoimmune disorders. But anyways, I will always stay my ground and always have my arguments and facts if anyone like to gain more information about the treatment for MS, since I'm a living proof that it might work and it's very effective for aggressive forms of MS and also for other forms of MS. Basically for anyone, it's a great opportunity. At least there is something that can possibly help people who are battling with this horrible, debilitating and horrible disease that is basically just killing you slowly and just eating your life away. Anyways, I'm going to meet a neurologist. I don't know who it will be, but I have to go for just a control, for a standard follow-up appointment, and to just probably I'm going to be examined. There will be some sort of clinical neurological examination and the usual. I'm not very keen on even discussing anything, because I'm just so fed up with the treatment I've had with neurologists in my home country, and I'm so sick of that. But anyways, I just probably just go with the flow and always stay focused on myself and just answer the questions if there will be any, and ask questions if I feel like it. But at the moment I don't feel that I don't have too many expectations. I just feel that it's something I have to do, but it always makes me nervous visiting a neurologist, because there might be something that might be come along or brought up during the examination, something new that I actually haven't even noticed. But that was this so far, probably the last vlog for this year. I thank you very much for everyone who has been watching, especially during this year, following my HSCT journey and my journey after the transplant. I hope you keep following my journey and my vlogs also next year, because I think it's very important to see how the first year, especially the first year after the transplant, is going, since I haven't yet completed it. But hopefully next year I will make some more positive and hopefully even more positive vlogs about my recovery and in general. And I just hope you have a lovely holidays and a lovely, amazing new year. Happy New Year and healthier New Year to everyone. Thank you for watching, and I hope to see you next year. Bye!